Heart failure is a condition that occurs when the heart can't pump as well as it should. So this may happen when the heart muscle becomes weak or stiff. So as a result of heart failure, the heart doesn't deliver enough blood to the rest of the body. This leads to the body getting less oxygen and nutrients. Heart failure can be a life-threatening condition, so it requires serious medical attention. Types of heart failure. So the main types of heart failure are named for where they occur in the heart. Number one, left-sided heart failure. So this involves the left ventricle. So when the left ventricle doesn't pump enough blood, it leads to the blood backing up in the blood vessels that carry blood away from the lungs. So left-sided heart failure is the most common type of heart failure, and it tends to cause breathing symptoms. Left-sided heart failure can be classified further as heart failure with reduced or preserved ejection fraction. So in heart failure with preserved ejection fraction, the left ventricle can't relax normally. As a result, the heart can't fill with blood between beats and the things back up. Then in heart failure with reduced ejection fraction, the left ventricle can't contract normally, so less blood gets into the circulation. So ejection fraction is the percentage of blood the left ventricle of the heart pumps out every beat. A normal healthy ejection fraction is 55% to 65%. Number two, right-sided heart failure. So this involves the right ventricle. So when the right ventricle doesn't pump blood well, blood packs up in the blood vessels that carry blood from the rest of the body to the heart. So this can push fluids out of the veins into other tissues, leading to swelling. Number three, biventricular heart failure. So this is a combination of left-sided and right-sided heart failure. So this involves both sides of the heart and can cause a mix of both types of symptoms. So clinicians also classify heart failure as acute or chronic. Acute heart failure is any heart failure that develops suddenly, such as after heart attack or arrhythmia. Chronic heart failure develops over time from medical conditions such as long-term hypertension, coronary artery disease. Today we're going to talk about the causes of heart failure. Heart failure is usually caused by other health conditions, so let's first talk about the three most common causes of heart failure. Number one, coronary artery disease. So this occurs when the arteries that supply blood to the heart muscle become narrow, causing the heart to work harder to pump blood. So eventually, coronary artery disease can weaken the heart muscle and affect the heart's pumping ability. Number two, heart attack. So this is also called myocardial infarction and can cause a scar tissue that interferes the heart's ability to pump. So heart attacks are usually caused by the blockages in the heart's arteries. Number three, high blood pressure, also known as hypertension. So this increased pressure on the walls of arteries can lead to heart failure. So let's also talk about other causes of heart failure. Number one, arrhythmia. So an irregular heartbeat can affect the heart's ability to pump effectively. Number two, cardiomyopathy. So this is a disease in the heart muscle that makes the heart less able to pump blood effectively. Number three, congenital heart defects. So these are structural problems in the heart that are present from birth. Number four, diabetes. So complications of diabetes can lead to heart failure. Number five, infection. So a previous infection such as endocarditis, myocarditis, or rheumatic fever can lead to heart failure. Number six, lung disease. So this includes chronic obstructive pulmonary disease, emphysema, or pulmonary embolism. So these lung conditions often cause low oxygen levels. So low oxygen levels can put extra strain on the heart, weakening it and possibly leading to heart failure. There are also some drugs that can worsen heart failure. So these drugs include antiarrhythmic medications, and we can also talk about specific chemotherapy medications for cancer. Stages of heart failure. So there are two classification systems for heart failure which indicate how severe the condition is. Your doctor might use one or both systems. On the New York Heart Association functional classification. So this considers the heart failure symptoms that happen during exercise to determine stage. So here patients can go back and forth depending on how well controlled symptoms are on a given day. So in stage 1, the person has the heart disease but it isn't yet causing symptoms or limiting activities. In stage 2, the person has mild symptoms that only slightly limit activity. Then in stage 3, the person has significant limitation to activities. He or she is comfortable when resting. In stage 4, the person has major limitation and experiences symptoms when at rest. Number 2, American College of Cardiology and American Heart Association. This is a separate system to classify heart failure. So here, once you reach a specific stage, you remain there or progress, but you do not go back. Stage A, so this describes a person who has a high risk of developing heart failure because of family history or personal medical condition. It's also called pre-heart failure. Stage B, so this is sometimes called silent heart failure. So this means that you have changes in your heart function, but you haven't developed heart failure symptoms. Stage C, so this means the heart failure has been diagnosed and the person has had symptoms. Stage D, so this is an advanced heart failure that isn't responding to standard treatment. Here a person has symptoms when they are being mildly active or even resting. So today we're going to talk about the diagnosis of heart failure. Your healthcare team may use a variety of strategies and tests to diagnose heart failure. Number 1, history and physical exams. So here clinicians listen to your heart and lungs and measure your blood pressure and weight. So they'll also ask you questions about your family's medical history, especially previous cardiac problems, questions about your lifestyle. This includes asking you whether you smoke or exercise, and also personal medical history. Number 2, blood tests. So this can measure several things related to heart failure. It can measure your sodium and potassium levels, and creatinine, which helps to measure how well your kidneys are working. Number 3, electrocardiogram. So this uses small sensors that measure your heart rate, rhythm, and electrical impulses. Number 4, chest x-ray. So this is a picture of your lungs, heart, and surrounding structures. It can show whether you have fluids in your lungs from heart failure or if you have heart muscle which is enlarged. Number 5, echocardiogram. So this uses sound waves to create images of your heart. So it can show how thick the heart muscle has become as well as measure the ejection fraction. Number 6, MRI. So this is an advanced imaging test that takes pictures of the heart and surrounding structure. So it helps to determine your heart function and size and whether there are any changes in the heart muscle. So a cardiac MRI can help your doctor identify causes of heart failure. So how is heart failure treated? So there are very many proven treatments to improve the heart function, symptoms, and survival for patients. So treatments also improve the quality of life by addressing any underlying causes, relieving symptoms, and improving overall health. Number 1, medication for heart failure. So certain medications can help treat heart failure and its underlying causes. These medications include aldosterone blockers. So these block the effects of the hormone aldosterone, thereby encouraging the body to release sodium and water. It also prevents scarring in the heart. Number 2, beta blockers. So these make the heart beat more slowly and with less force. They also help to keep the heart rhythm regular. Number 3, sodium glucose transport protein 2. So inhibitors are diabetic drugs that have been recently found to be beneficial in heart failure. Number 4, angiotensin receptor neprilysin inhibitor. So this reduces excess fluids in the body and relaxes the blood. So this makes it easier for your heart to pump blood. Other medications that can relieve heart failure symptoms include diuretics, which reduce the amount of fluid in the body, vasodilators, which dilate the blood vessels and reduce the heart's workload, digoxin, which helps the heart beat stronger with a more regular rhythm, antiarrhythmics, so this control arrhythmia and maintain the normal rhythms of the heart. Number 2, surgery of the heart. So your doctor may recommend surgery to implant a medical device that helps the heart function more effectively. These devices include pacemaker, which maintains a steady heartbeat in people with a slow or irregular heartbeat. Number 2, implantable cardioverter defibrillator. So this monitors the heart for fast rhythms and delivers an electrical shock to reset normal rhythm. Number 3, left ventricular assist device. This takes over the pumping action of the heart. So people with advanced heart failure may be candidates for heart transplantation. A heart transplant replaces the diseased heart with a donated heart from a person who has died. Complications of heart failure. Number 1, arrhythmia. Number 2, blood clots, which can lead to pulmonary embolism or stroke. Number 3, impaired kidney function or liver function. Number 4, muscle wasting. Number 5, pulmonary edema. Number 6, respiratory distress. Thank you very much. I'm Moji. Please follow me, like, and share my video.